Risk factors for long COVID. The following are risk factors that increase the likelihood of developing long COVID. There is higher risk with severe COVID-19 infection that required hospitalization and a greater number of symptoms during the acute infection. 21.9% of patients over 70 years reported symptoms persisting for 4 weeks or more, compared to 9.9% aged 18 to 49 years. Women aged 40 to 50 had double the risk of developing long COVID compared to men. Low-grade inflammation associated with type 2 diabetes may worsen during acute infection, causing high levels of inflammation post-COVID infection. Post-COVID pulmonary fibrosis is more common in patients with uncontrolled diabetes. People with moderate to severe obesity have higher risk. 67.8% of asthmatic long COVID patients reported more frequent use of their inhaler therapy, 73.7% reported increased difficulty breathing, and 59.6% reported decreased asthma control after initial COVID-19 infection. A significant proportion of patients experienced protracted asthmatic exacerbations, worsening of asthma symptoms, and the occurrence of additional symptoms besides their usual symptoms. Hypertension has now also been implicated as a risk factor for long COVID. A dampened or otherwise dysfunctional immunity is a crucial contributing risk factor for long COVID. Certain genetic markers have been shown to be a risk factor. Some are HLA genes and interferon signaling pathways, in addition to mutations that affect the function of the ACE2 receptor. Also, a certain gene variant significantly elevated the risk for severe COVID-19 and is found in 50% of South Asian and 16% of Europe inhabitants, but is rare in African populations. History of psychiatric illness. Psychological distress preceding the acute COVID-19 infection increased the risk for long COVID by 50%. Non-white race is a risk for developing long COVID. Black outpatients were found to be at higher risk of experiencing long COVID symptoms, in addition to Black Afro-Caribbean ethnic groups, mixed ethnicity and other minority ethnic groups containing patients of Polynesian, Middle Eastern or Native American origin. Some additional risk factors include hypothyroidism, previous autoimmune disease, previous Epstein-Barr virus, EBV, infection, high viral load during acute COVID-19 infection, lower socioeconomic status. Follow me as we continue to discuss the risks, treatment options, and outcomes for long COVID. Do you want to learn more about long COVID? Like, subscribe and share if you found this video useful.